If you're over 70 and coping with leaks or unexpected impulses that appear to come out of nowhere, you're not alone and you're not powerless. Have you ever felt ashamed because you couldn't hold your urine in time? The bladder is influenced by everyday habits, simple things you do without thinking that either help or subtly worsen the condition. Most people are unaware of this. Many older women believe it's just a natural part of aging, something to hide or live with silently. This video is about raising awareness, not shame. We'll go over 8 particular behaviors that many women over 70 engage in on a daily basis that contribute to the frequency and frustration of bladder leaks. If you've ever felt depressed or even ashamed about wetting your pants, you deserve better. There are changes you can make that will help you feel more in control and less anxious when you leave the house or laugh with friends. Stay with us until the end because the last few habits may be the ones you've been doing the longest. These habits are subtle, often ignored, and occasionally passed down as normal ways of managing your day, but the truth is that doctors warn that these behaviors may be P. Let's navigate this together. First, resisting the impulse to urinate. Holding your urine for too long may seem harmless or even beneficial, but it is one of the most common practices that subtly exacerbates bladder leaks. Every time you resist the urge to use the restroom, you're telling your bladder that it needs to stretch past its natural limit. Over time, this can weaken the bladder muscles and confuse the normal signals. You're trying to be efficient by avoiding too many bathroom trips or waiting for a more convenient time. Your body sends what starts as a delay becomes a habit, and that habit turns into a new baseline for your bladder. One where urgency hits faster and more unpredictably because the muscle has lost some of its tone. You may notice that when the urge does come, it comes on strong. There's less time to respond and your chances of making it to the bathroom without leaking become smaller. This is especially challenging for older adults because the body's reflexes aren't what they used to be. What used to be a 5-minute warning might now feel like 30 seconds. And if your muscles have been trained to hold for hours, only to be emptied in one big rush, they're less likely to respond when you truly need them to. It's not just about muscles either. The bladder is part of a larger feedback loop with your brain. When you keep ignoring the urge, your brain gets used to tuning out the signal, and when you want it to listen, it might not respond fast enough. That's when surprise leaks happen, often at the worst moments for women over 70, especially those managing mobility issues or who dislike public restrooms. This habit is frequently formed with the best of intentions, so you may believe I'll just go when I get home, or perhaps I don't want to be a bother. However, holding on for too long might cause further problems down the road, not only from accidents but also because it makes the bladder unpredictable. Instead, try using the loo every 2 to 3 hours. Even if you don't feel a strong urge, this helps retrain your bladder to stay in rhythm and it keeps those muscles active without overstraining them. It's a small change, but over time, it can reduce both urgency and leakage. So the next time you feel the need to go, honor it. Listen to your body. It's not an inconvenience. It's a signal. And when you treat it with care, it tends to respond with the same. Number 2, drinking too much fluid. Before bed, a glass of water. Before bed might seem harmless, maybe even comforting. For some, it's part of a nighttime ritual. You sip, settle in, and drift off. But for women over 70, the timing of your fluid intake can have a much bigger impact on your sleep and your bladder than you may realize. As we age, our bodies process fluids differently. The kidneys often become more active at night, which means more urine production while you sleep. If you add a full cup or 2 of liquid in the hour or 2 before bedtime, you're practically guaranteeing that your bladder will be full in the middle of the night. And if you've already been experiencing leaks or urgency, that full bladder can wake you abruptly, or worse, empty before you make it to the bathroom. Many older adults also deal with reduced mobility or slower reaction time when getting out of bed. Combine that with a dark room, cold floors, or a stiff body, and you have the perfect storm for a nighttime accident. Not because you don't care, but because your body simply can't move as fast as it used to when the pressure builds. There's also the matter of sleep quality. Even if you manage to get up in time, repeated nighttime bathroom trips can interrupt your sleep cycle and leave you feeling groggy and frustrated. The next day, poor sleep makes everything harder, from memory to balance to mood, and it can even make bladder control worse since fatigue affects muscle response and timing. The solution isn't to avoid drinking fluids altogether, but to shift your intake earlier in the day. Make it a habit to hydrate well in the morning and afternoon, then taper off after dinner. If you feel thirsty at night, take a few small sips instead of a full glass, and if you take medications with water. At bedtime, talk to your doctor or pharmacist about whether they can be moved to an earlier time. Even that one adjustment, reducing how much you drink in the evening, can dramatically lower the number of nighttime accidents and give your body a chance to rest, repair, and regain some control. Because bladder leaks don't just affect your confidence, they affect your quality of life, and sometimes avoiding them starts with something as simple as knowing when to. Please leave a comment in the second section below to let me know you're still watching this video and finding these insights useful. If you haven't subscribed yet, I suggest doing so and turning on the bell so you don't miss any more videos. Your assistance enables us to keep producing quality information that will educate and motivate you. Let's proceed. Third place for many women, drinking caffeinated beverages like coffee or tea in the morning or afternoon is more than just a beverage. It's a ritual of comfort, a time of calm, or a social habit shared with a friend. However, you might not be aware that caffeine, although it may seem familiar and calming, may be subtly irritating and making it harder to control your bladder. Caffeine is also a bladder stimulant, increasing muscle contractions and making your bladder feel full even when it isn't. For people who already struggle with urgency or incontinence, this double effect of increased urine and stimulation can result in more frequent leaks. And it's not just coffee. Caffeine is known to be a diuretic, which means it encourages your body to produce more urine, which is part of the reason you feel the urge to go right after your morning brew. A small dosage of caffeine can throw everything out of balance. So decaf doesn't necessarily mean caffeine-free. Caffeine is an ingredient in many teas, sodas, chocolate drinks, and even some pharmaceuticals. For older women, especially those who are trying to stay active socially or stay hydrated, caffeine is often whispering to your bladder, not your age. You may have noticed this without knowing what caused it, such as suddenly needing to run to the toilet after your usual breakfast or not making it through a car ride without stopping. You may have even blamed it on aging. While completely giving up coffee or tea may seem excessive, cutting back on your intake, particularly in the late morning or afternoon, might have a significant impact. Even making the move to non-caffeinated or herbal teas, the strain on your bladder can be lessened by doing this 2 or 3 days a week. You might also try seeing how certain people react. Having 1 cup in the morning is doable, but having 2 or 3 leads to problems. It's not necessary to give up everything you enjoy. Rather, it's important to be aware of what helps your body function better and what subtly interferes with it. Sometimes simply switching to a caffeine-free beverage instead of your typical one can result in a noticeable improvement in control, comfort, and confidence. Pay attention to what your body is telling you. If leaks tend to occur on days when you consume more caffeine, it might be time to modify your intake. Fourth, failing to perform pelvic floor exercises. Your pelvic floor, a collection of muscles at the base of your body, is one of the most underappreciated reasons of bladder leaks in older women. Pelvis supports your bladder, uterus, and bowel. Like any other muscle, it deteriorates with age. If you don't use it, especially after childbirth surgery or during menopause when hormones change, this weakness can manifest in minor but annoying ways, such as a laugh turning into a leak, a cough surprising you, or a sneeze ending in discomfort. These are not mishaps. They are indicators that the muscles responsible for holding objects in place are weaker than they once were. According to doctors, strengthening your pelvic floor with specific exercises known as can significantly reduce or even stop bladder leaks. It's tragic that many women don't realize they can do anything about it because they believe this is just what happens after 70 and begin using pads or avoiding certain activities. Because it's a simple clench and release motion, similar to trying to stop the flow of urine midstream, you can perform these exercises anywhere, sitting in a chair, lying in bed, waiting at a stoplight, etc., and repeating them throughout the day makes them more effective. Strength is what counts most, but consistency is essential. Just as you wouldn't expect your arms to get stronger by lifting weights once a week,
Your pelvic floor requires consistent, focused effort. Start with small contractions, 5 or 10 at a time, a few times a day. Over time, as the muscles respond, you may notice better control, fewer leaks, and even improved posture or core stability. There's always time to get started. The most important thing is that you don't have to accept leakage as your new normal. Your muscles are made to support you. They just need a little care. If you're not sure you're doing them correctly, many physical therapists specialize in pelvic health, and they can help you create a plan that suits your needs and lifestyle. Some women in their 80s have seen noticeable improvements after just a few months of consistent practice. Number 5. Avoiding bathroom breaks during the day may seem innocuous, especially if you're out shopping, watching a movie, or just don't want to be that person who always makes excuses. But if you do this on a regular basis, it can train your bladder in ways that can backfire. The bladder is a flexible organ that contracts when it's time to release urine and stretches to hold it. However, if you frequently go for extended periods of time without urinating, this can cause the bladder to become overstretched over time, which can lessen its sensitivity. This means that you won't feel the urge until it's already very full, which is where the problems start, because when it does, it often feels sudden and urgent, and leaks are more likely to occur in women over 70. Muscles deteriorate with age, and a delayed reaction may make the difference between making it or not. What was once a manageable inconvenience becomes a source of embarrassment or anxiety because the bladder has been trained to wait too long too frequently. Ignoring your body's natural cues repeatedly also creates a psychological pattern where you begin to trust them less and start to doubt whether you really need to go. Instead, you tell yourself, "I'll wait just a bit longer." The good news is that this habit can be gently reversed. For example, establishing a routine of using the restroom every 2 to 3 hours, even if you don't feel a strong urge, can help retrain your bladder by keeping the volume manageable, reducing stretching, and giving you back more control over timing. It also helps prevent the panic that comes with sudden urgency when you're out in public or away from a restroom. To put it another way, it's like tuning an instrument. The more consistently, your bladder is no exception. If you've been rushing through the day without stopping, thinking it's saving you time or hassle, keep in mind that those little breaks might be saving you more than you realize. They're protecting your comfort. Regularly allowing it to empty helps maintain its natural function and reduces the risk of unforeseen accidents. Your self-assurance and sense of mastery. One trip to the toilet at once. Please let me know in the comment section below if you're still watching this video and find these insights helpful. If you haven't subscribed yet, I suggest doing so and turning on the bell so you don't miss any more videos. Your assistance enables us to keep producing high-quality content that will educate and motivate you. Let's proceed to number 6. For older women, particularly those who suffer from chronic constipation, the relationship between the rectum and the bladder is not only physical, but structural as well. The rectum and the bladder sit directly next to each other in the body, and when the bowels are backed up, they press against the bladder, reducing its space and function. This may surprise you if you experience constipation frequently. Your bladder must work against the pressure created by your full intestines, which can increase urgency, limit how much the bladder can safely hold, and force the muscles around the bladder to work harder. The result is unexpected urges, unintentional leaks, and the annoying sensation that you just used the loo yet already need to use it again. It's like trying to blow up a balloon inside a packed luggage. Many elderly people suffer from constipation in secret, unaware of how much it affects their bladders. You may believe that it's a natural part of aging, or that you need fewer toilet visits, now that your appetite has changed. But slow or irregular bowel movements are frequently caused by dehydration, a lack of fiber, decreased mobility, or even medications. These issues are common in people over 70, and if ignored, can subtly develop into a daily issue that impacts breathing, digestion, sleep, and bladder control. If any of these symptoms sound familiar, your bladder may be reacting to the strain of constipation, even if you haven't put the pieces together yet.
Staying hydrated and increasing your intake of fiber from fruits, vegetables, and whole grains are good places to start. Some women notice that they leak more during or immediately after a bowel movement, while others experience lower abdominal pain but are unsure of the cause. Your digestive system will remain active if you engage in gentle movement every day, such as walking or stretching. If you are taking medications that cause constipation as a side effect, discuss with your doctor about gentle remedies or alternatives that can support regularity. When your bowels move comfortably, your bladder has the room and support it needs to function properly. You may not notice the change right away, but you will probably feel less urgency over time, less unpleasant surprises, and more thorough emptying. Seventh, clothing that is too tight around the midsection might affect our bodies more than we sometimes realize, particularly when it comes to bladder control. Because they feel comfortable or because they are habitual, many women over 70 still wear tight-fitting trousers, compression garments, or tight waistbands. However, when clothing presses too tightly around the midsection, it can subtly press against the bladder and limit its capacity to expand comfortably. If you wrap that, picture your bladder as a balloon attempting to fill with water. Squeezing a balloon in tight clothing reduces its stretch, which produces a false sense of urgency that makes you feel the need to urinate even when your bladder isn't full. Over time, this external pressure may cause you to experience urges more frequently, increase susceptibility, and a higher chance of unanticipated leaks. You may not think that your clothing is tight, especially if it still fits or you've worn it for years, but as our bodies change, even familiar clothing can start to dig right up or hold in ways they didn't before. This is especially true after weight shifts, surgeries, or digestive changes. You may notice red marks on your waist at the end of the day, a feeling of bloating, or even discomfort when sitting down. Tight clothing can also interfere with your pelvic floor, which are the muscles that support your bladder, and they depend on flexibility and movement to function properly. If your clothes restrict the area around your hips and belly, those muscles can't engage as freely. All little indicators that your attire may be more detrimental than beneficial. You don't have to forgo comfort for style. Seek out high-rise pants that more evenly distribute pressure or elastic waistbands that stretch without squeezing. It's a small adjustment, but for some women, changing just one pair of trousers or skipping the control top layer has reduced their bladder discomfort almost overnight. It's not about giving up what you love. It's about listening to your body and giving it room to breathe, move, and function at its best. Number 8. If you wear support garments for posture or back pain, consider reducing the amount of time you wear them or switching to ones that target specific areas without compressing the entire weight. One of the worst behaviors isn't even physical, rather it's the things we tell ourselves. Many older women start having urgent bladder leakage or accidents at night and silently believe that this is just what happens at a certain age. This assumption alone prevents countless women from getting the care they need. The truth is that just because something is common, it doesn't mean it's inevitable or that you have to go through it. It's easy to get into that mindset when you see friends dealing with the same thing, hear it mentioned in passing, sometimes with humor, sometimes with embarrassment, and even doctors may not bring it up unless you do. Bladder leakage can be caused by dozens of curable factors, many of which are unrelated to age. Weak muscles of the pelvic floor, adverse drug reactions, hormonal alterations brought on by nutrition after surgery. All of these issues are resolvable, but only when someone raises their voice. Too frequently, women wait until the problem has interfered with their sleep, social life, travel plans, or confidence before speaking up. By then, they may have centered their entire day on dealing with leaks, packing pads in their purse, planning routes around restrooms, or staying at home entirely. This is not only uncomfortable, but it's also limiting, and doctors today have more. If you've been blaming yourself or thinking it's too late to make a change, I want to gently remind you that your body is still listening and that it can still heal, strengthen, and adjust, but you have to give it permission, which often begins with letting go of the belief that this is just aging and replacing it with this deserves. There are more respectful ways to reduce or even stop incontinence than ever before, including pelvic floor therapy, medication adjustments, behavioral strategies, and even outpatient procedures. If you're still watching this video and finding these insights useful, please leave a comment number 8 below to let me know you're here. If you haven't subscribed yet, I recommend you do so, and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move on to our final thoughts. attention because it does you. Asking your doctor to try one new habit, even just learning more, is not admitting weakness, it's reclaiming strength quietly and completely on your terms. Following our discussion of these 8 hidden habits, it's important to consider how many of them have subtly crept into your daily routine, not due to negligence or carelessness, but rather to habit comfort or the conviction that nothing can truly change. The reality is that bladder control after 70 is about awareness, and awareness gives you choices. It's not just about getting older. You now know that holding it in too long trains your bladder the wrong way, that too much fluid at night or a second cup of coffee can tip the balance that week. Pelvic muscles and overlooked constipation are connected in more ways than we're usually told, that even your clothing and your mindset have a role to play in your comfort. You also know you're not alone. Many women in their 70s and 80s are walking through this quietly, managing, adjusting, but also longing for something better. The good news is better is possible. You don't need to accept leaks, urgency, or nighttime accidents as your new normal. You can take small, consistent steps to regain confidence, comfort, and control, and every change you make, no matter how small, sends a message to your body. I'm still paying attention, I still care. So which habit stood out to you most? Was it something you've always done, never thinking it could affect your bladder, or maybe something new you're willing to try starting today? This isn't about doing it all at once. It's about starting where you are and giving yourself the grace to grow. Because life after 70 isn't the end of your story. It's still your story, and the more comfort and confidence you have in your body, the more fully you get to live it. We appreciate you being here today, and we would love to hear from you. Please leave a comment below with one thing you learned today and how you intend to apply it in your life. Your opinions are valued, so please feel free to share them. If you liked this video and found it useful, please like, subscribe, and share. Your support helps us keep producing quality content to educate and inspire you. Thank you for watching, and we hope to see you in the next video. Reading your comments gives us a lot of motivation and encouragement.